Hey, Dr. Alan Christianson here with you, and this is the third step toward recovery from thyroid disease. This one is about medications. Excuse me. Now, these are early in the process because they're important to get right. People are often on medications if they need them or not, and they may be on the wrong ones. They may be on them unnecessarily, or they may need them and they may not be on them. But these are critical. If you're not in the right scenario with medications, it's pretty tough to make progress otherwise. If you need them and you're not on them, it's hard to get better. If you don't need them and you are on them, it's hard to get better. And if you're on the wrong ones, same thing. So these are important, and I would argue that, boy, nearly everyone that I've seen over the years, and I've had about 100,000 patient visits, nearly everyone has something not right about medications. One of those three things that I mentioned. So when I say that they can help, they can benefit, what does that mean? Well, when someone's a good candidate and they're on the right kind of medication, it can improve their symptoms. It can help them lose weight, help them have more energy, help hair come back again. It can also cut their risks. With thyroid disease, there's a risk for other versions of thyroid disease, but there's also other chronic diseases that are more likely. And the appropriate use of medications can cut all of those risks. And then also we see that there's other conditions altogether, other chronic diseases, things like diabetes or heart disease. The right use of medications can cut those as well. But the wrong use of medications doesn't improve any of those. If someone does not need medications, not only can it not help improve their symptoms, but it might actually cause those very symptoms. Here's one specific scenario that's crazy common. Someone has gained weight from thyroid disease, and a well intentioned doctor wants to help them lose weight and therefore gives them thyroid medication. Well, if they're not someone that really needs the medication, it might make them gain more weight and it might make their weight loss efforts not work. And this is so common. Or another scenario where if someone does need medication, maybe they're given more than they need because someone thinks that a higher amount will help. And that doesn't work either. And it's not even a matter of just, well, maybe it works sometimes, maybe not, maybe there's some risk, maybe not. It just doesn't work. There have been big papers done on this in which large numbers of people on different amounts of medication are tracked. And it's tricky because when you're looking at this yourself, there's a lot of variables, there's a lot of moving parts. It's hard to know what is doing what, good or bad. So that's where it's nice to have studies in which that's just the only option changed. And so we know what that option does in isolation. So let's talk about who needs medication, who has to be on their medication and has just no other options. Quite simply, that's those who lack a thyroid. That's the end of the list. Now, there's others who may well benefit from medication, and they can be a reasonable option, but not the only option. And I'll talk about that next. But yeah, if you lack a thyroid, you need medication. Now, I'm a little OCD. I can't not tell you something when it's not completely true. So what I just said is not completely true. There are some people who were told their thyroid was taken out and a chunk of it was left behind, and that chunk grew back. So I've seen that. And there's a thing called lingual thyroid tissue. You always see that butterfly thing, right? Well, some of the butterflies have a little tail. They've got a piece along the bottom or even along the top, and that may be missed during surgery. I've seen that. Now, this is not common, but yeah, if you lack a thyroid, you should just figure you need medication long term. And I'll talk a lot more about that in other discussions. There's still many things you can do, and diet and lifestyle still matter. So, past that, who else can medication have a good chance of helping? Well, that would be those who have what's called overt hypothyroidism. If you're looking at the blog, I've got a chart that shows what this means in terms of blood tests. Basically, it means your TSH level was really high, like 20 or greater, and your T4 was below range. I don't mean low normal, I mean way below range. In those cases, medications have a good chance of helping in all those ways we talked about. Now, it's not the only option. There's actually been a study showing that regulating iodine per what I described in the thyroid reset diet can help upwards of 60% of the time. That's 60. So that can still be useful, and you may not need medication. But if you do have overt hypothyroid, meds are a reasonable option, especially if you've already tried diet therapy. So now, who are medications not likely to benefit? Well, everybody else. So those that have what's called subclinical hypothyroidism, which means the TSH is elevated, but the T4 hasn't shut down, gone way below range, and those with suboptimal thyroid function. And that means those to where their levels are normal, but there's some other reason to where someone thought they could benefit from medication. Maybe their levels were normal, but not what we could call optimal. Maybe they had some really suspicious thyroid symptoms, or their T3 was low, or they had high antibodies, or they had a low basal body temperature. These are all things that are real, and they're all things that can correlate with symptoms. They really can affect your health, and don't let anyone tell you otherwise. But on average, medications are not likely to help. Now, there are many people to where they've had issues like that, and they felt that medications were helpful. So what do you say about that, Dr. C? Well, what I say is that's just not likely. It can happen. I'm not saying it's impossible, but if you're looking at the situation anew and saying, "Hey, I'm entering this and I'm in this scenario, are medications likely to help me personally?" They're not. And it's important to make that distinction because they do cause risks. But again, what about those in which they did seem to help? Well, a couple thoughts. The biggest single thought is that it's almost never the case that someone only does medication. They generally do a lot of other things at the same time. They change their diet, they do nutraceuticals, they do mind body therapies, you name it. Those other things are more powerful than we think. And I would just really own this for a lot of years. I was the kind of doctor who would take someone who now I would say didn't need medication, and I would have likely started them and done a lot of those other things. And I would have likely over overestimated the benefit of the medication. So yeah, in most cases when someone does get better and medications are part of their care, but they weren't in the category that I'm now saying medications are needed, the other parts were doing more than we thought. So that's totally cool. And that's important because the more your body can do on its own, the better. And it's a great that we've evolved toward that. So what if you're someone who is already on medication and maybe you're in those categories to where they weren't needed, they weren't necessary for you? Well, here's the big action steps. For starters, you want to really do all the things to help your thyroid work as well as possible. Easiest first one is use supportive nutraceuticals. And across the board, Thyroid Daily, these are all by thyroid specific formulations. Thyroid Daily is the best starting place for that. If you're someone who's on a T4 medication like Synthroid or levothyroxine, also consider T2, T3 converter. That'll help your body get more out of that. You'll get more T3, more T2, more of these other important thyroamines. If you're someone with high thyroid antibodies, consider antibody support. That's an easy thing to add in to help lower them. In so many cases, people who don't have their thyroid removed and don't have overt hypothyroidism, but do have symptoms, it's more about the autoimmunity and it's less about the thyroid levels. Meds don't help the autoimmunity. Easy step though for nutraceuticals, thyroidspecificformulations.com. There's a quiz on the first page, and just go to the link to the quiz and it'll ask you about your symptoms, your needs, your goals, and they'll make recommendations for what is appropriate for you. Second step, if you are on meds, even if they're not needed, you don't want to overdose. You don't want to be on more than you need. How do you know if you're getting too much? The earliest sign of that is the TSH goes below range. It's only in later stages that T3 and T4 elevate. When you get too much, it can make you feel like you're getting too little. I mentioned earlier about the weight gain problems. That's very common. There's so many people who are on meds they don't need or are on too much, and they're making them gain weight. So, really common. Yeah, first step is don't take more than you need. Next step after that is consider de-prescribing. Reasons for that? Well, kind of a cool idea to have your thyroid work by itself, but also some more very practical reasons. One big one is you can improve symptoms. I've seen this a lot, and it took me some time to wrap my head around it, but taking a hormone is not the same as making a hormone. What your body makes by itself, it's not the same when you take that in a pill. Even if that one molecule is the same, it's not the same thing overall. And it's really common that when you're taking something your body would make, you cause your body not only to make less of that, but you cause other changes in many related steps. And those other changes can make you not feel well. So the more your body can do by its own, the better. And that's true by degree. So even if you're simply lowering a dose by a little bit and not coming off entirely, that can still correlate with improvements in symptoms for many. The other benefit about taking less is lowering risks. Don't want to be shocking, but there is an increase in many risks from those on thyroid medications, especially when they're not needed. Those include the risks for many cancers and also for total mortality. So, yeah, cutting those risks is always a good thing. The other big thought we think about is that it's just one less thing for your body to have to regulate, and it can do a better job on regulating everything else. So, wrapping this up, so in summary, thyroid medications, they're powerful, they're potent, and they can be life saving. It's an awesome thing that we have them. It's great that we have a lot of options. Yet, they're so powerful. They've got to be used precisely correct. And if you're not on them but you need them, or if you're on them and you don't need them, or if you're on the wrong amounts, these things can hold you back badly. And this is a really important decision to make. It's just taking a pill or not. It's not a hard thing to do, but it's an important thing to get exactly right for your body. Please look through this article closely. Consider why you were put on medications. The idea about your diagnosis, whether it was lacking a thyroid, being overtly hypothyroid, subclinical, suboptimal, that it's all about where you were before you went on medication. Where were you before then? What was the reason for going on medication? And if that reason wasn't one that would cause you to need medication long term, consider deprescribing. Work with a doctor to be sure that you're taking exactly what you need, no more and no less. So, the next installment in this series about your first steps, we'll talk about secondary conditions that go with thyroid disease. These are important because nearly everyone has them. They cause a lot of the symptoms and they're often missed. So, stay tuned. Dr. C with you. Back with more real soon. Bye bye.